welcome to another edition of Insights. My name is Marty Guthmiller, CEO at Orange City Area Health System. And today we're shifting gears just a little bit from our first two editions of Insight dealing with canal heist and taking a look at an expanded new service here at Orange City Area Health System in the field of ophthalmology. Today joining me is Dr. Mick Vanden Bosch, who joined our team here at Orange City Area Health System in January and previously conducted outreach clinics here through Sanford. Thank you for joining us this morning. I appreciate that very much. As I mentioned, you previously worked at Sanford and Sanford Health, but Vanden Bosch is a pretty staunch Dutch name. I hope I'm pronouncing it correctly because, you know, we don't do Dutch around here.
You do better than some of the patients do.
All right, great. Well, could you talk to us a little bit about where you're from, who you are of, as we say?
The name does put me in Sioux County, and it was pretty easy to tell the people when I was in Sioux Falls. I grew up in Sioux County, first in Hull, and then in Sioux Center for most of my upbringing. My dad was an English teacher, first at Western Christian, and then went to Dort and spent his career there.
Great, great.
I've been in South Dakota for 18 years, but I still consider myself an Iowan.
Excellent, good. Well, we're certainly glad you're here. How long have you been an ophthalmologist?
28 years.
And I assume you went to a medical school.
I did. After Dort,
where was that?
After Dort, I went to University of Iowa. Spent 4 years there for medical school. Went to Kalamazoo, Michigan for an internship for 1 year, and then back to Iowa City for another 9.5 years. Another 5.5 years.
Wow.
Total of 9.5 in Iowa City.
You know, one of the things in healthcare that I've grown to appreciate is the amount of training, the years that it takes, and the effort that it takes to acquire a skill set such as yours. So I know as a private citizen, I'm greatly appreciative of that. So interests outside of health work or healthcare, can you talk to us a little bit about that? I know you have a trip coming up next week that is not, well, it's healthcare related.
It's healthcare.
But it's
our family vacation.
Tell us about that. Yeah.
For the last 16 years, our family vacation is a week in Dominican Republic.
Excellent.
Doing eye care and make my wife and daughters help me in the operating room and the clinic.
Excellent. So did you just say, was that an annual thing that you do, or is it? Yeah, great. Super. Let's shift back to the field of ophthalmology just a little bit. I know a lot of people might think of ophthalmology in terms of cataracts, and certainly that's part of the equation, right? So, but what other kinds of eye healthcare or vision procedures do you offer?
Cataracts is by far the most of what I do. Probably 90% of my surgeries are cataracts.
Okay.
Other eye surgeries, laser procedures related to secondary cataracts, glaucoma, diabetes. I used to do glaucoma surgery. I don't really do much of that anymore. Eyelid surgery is probably where I used to do the other 10% of my surgeries, droopy eyelids or an eyelid that rolls out or rolls in.
Excellent.
Crossed eyes or eyes that wander out, straightening eyes is something I do as well.
So are most of these procedures done in your clinic, or are they done in the OR typically?
Those are all done in the OR except for the laser procedures.
Okay.
I also do taking off skin tags or any eyelid lesion, and unless they're large, that's done in the clinic.
Okay. So most of the stuff is in the OR then.
Yeah.
So you probably surgeries before you came to Orange City. Have you done 13 or 14 of those, or how many cataracts would you guess?
I counted a rough estimate 2 years ago,
okay,
and it was 7,500. So
right.
I'm well over 8,000 now.
Yeah. All right. Perfect. If you were to, you're speaking to thousands and thousands of people, I'm sure listening to this video today, but is there anything that you would like to alert people to? If there's any eye condition that they should contact their ophthalmologist or maybe even optometrist, or is there anything that you would alert people to?
Most people are pretty concerned about their vision. A significant change in the vision, like loss of vision, obviously, can't see anything, or it's a significant change. That's probably something that should be checked out sooner rather than later, because even though there are conditions that we can't treat, there are some that we can. And some of those have a very tight, it's rare, but there's a very tight window for when treatment can be done. A little bit of blurring that kind of comes and goes, that's not an emergency. That can be watched typically can be watched for a few days or a few weeks and say, yeah, I don't really think it's getting any worse. It's not bad to have that looked at.
Sure.
But if it comes up on Friday night, you can probably wait until after the weekend.
It's interesting you say Friday night. We've talked recently about, I had a situation personally with myself on a Friday night, and I went, like this and like this, and I'm thinking, man, I'm not seeing very well on a one eye. And sure enough, that required some follow-up in the ER and follow-up in ophthalmologist. And but you're right, it was something like, I knew I needed to be checked because it was something weird and it was something fairly emergent. So good. How can people see you? How do they get to you? Do they need a referral? Can they call directly? How does that work?
I'm considered a surgical subspecialist, but in ophthalmology, well over half of the patients I see are primary care patients that call and want to be seen. The other half are referred by optometrists or other medical specialties. But yeah, patients can call and say, hey, I want to see an ophthalmologist.
Okay, so this is a test for you. What number do they call?
712-737, and I don't know after that.
yeah, that's not fair. I told you I wasn't going to do a trick question. Actually, the number is 737-5241. So if you want to call directly to Dr. Vanden Bosch, 737-5241. If you forget that and you're used to calling our 2000 number at the clinic, that'll work too. We'll get you transferred over, but 5241. And then also we have a great relationship, and Dr. Vanden Bosch has a great relationship with area optometrists. And so if you do require a referral from your optometrist, certainly mention Dr. Vanden Bosch's name, and we can get you in and do that. As we close out today, is there any advice that you would offer folks, other than if they see significant change to come in? Is there anything that they can do to maintain eye vision health? Anything in the closing manner?
You'll see a lot of stuff for eye vitamins. There's no proof that eye vitamins help other than a very small subgroup of people with macular degeneration. But if you don't know if you're in that group, and that study was done over a 9-year period, so what happens if you took the vitamins for 18 years? They seem to be safe over that period of time in the study as well. So eye vitamins are probably reasonable, but you don't have to take them at the dose that was taken in the study. So the eye vitamins that cost a bit, if you find a generic version of that, and you'd have to take 4 of those to equal what they use in the study. Taking 1 or 2 of those is probably not unreasonable. If you're a person that is not big into taking pills, there's no proof that it helps. So don't lose sleep over the fact that you're not taking vitamins to maintain your eyes. Yeah. Carrots are good. Because
the natural solution.
The natural solution. The beta carotene that gives the carrot its color is a form of vitamin A that's very important for vision. Excellent.
Good. Well, thanks. I appreciate you joining us today. I appreciate you being on OCH's health team moving forward. And we look forward to working together. Appreciate that. Thank you. That's going to be it for today's edition of Insights. Look for more editions coming soon. Thanks, everyone.